Your report of findings is an opportunity to show your patient what the plan is, but more importantly, is the time where they decide whether chiropractic care is worth their time, their energy, and ultimately their investment. That decision doesn't just happen because of your findings. It's also based on how you present the information to them. Get this wrong and even the right diagnosis won't get someone to commit to their care. I'm Dr. Dustin Scott. I run a 7-figure chiropractic practice in Central Iowa. And in my spare time, I help other chiropractic practice owners bring more value to their communities and scale their impact. Today, we're breaking down every part of the report of findings framework that your report should have, so you can take your new patient start percentage to an elite level. Real quick, before we dive in, I put together a free KPI stat sheet for chiropractic practices. New patients per week, collections per visit, patient visit average, and more is in one ready-to-use spreadsheet. This is the exact stat sheet that my receptionist fills out and that my practice reviews every week. If you don't know your numbers, your business is just a guessing game. Link is at the top of the description. Sign up, confirm your email, and it's yours. The first part of your report of findings should be reestablishing your connection to them and reestablishing why they're there. Now the patient comes back for that day 2, and I always congratulate them for coming back because that's the next step for them. Ultimately, we want to make sure that we are connecting with them on a deeper level than just trying to present them some kind of care plan. Really, it's about the deeper why on why they came in. During that consultation, obviously we're going deeper than just their pain points. So they might have kids, they might have a hobby, or they might have a job that their entire family is relying on. So we're connecting back to that. The next step should be showing your findings. As you sit down with your new patient and you're going over their personal findings, there's a couple things we're gonna do. First and foremost, we want to ask them as many questions as possible. It's asking them the question and letting them come to the conclusion in their mind on what we need to do, preemptively from the education that we provided on day 1. So what we'll do is we'll ask. Now you remember we took these pictures yesterday, right? You taking a picture on your phone. Had you had a chance to talk to your husband about this, or wife, or maybe someone that helps them make their health decisions? Then we bring them up right next to the screen and have them touch right on the spot. It might be the arthritis, it might be the disc, it might be the joint or the curvature that was off. We want them to be able to connect with that. We want to make sure that they're involved. So being able to show them exactly what we're going to be working on and what our goals are. Next, where's our goal going to go? So we want before and we want after. So we let them know. Now look, by the time we're done in this next 4, 6, 8, 12 months, we want this to be straightened, or we want there to be some space increased in between those discs. From there, we get a time commitment and really engage to qualify to see if that's something they're willing to commit to. 3D consultation has upgraded their technology to be so appealing to the patients where they can really understand. This shows mechanically the decompression table starting to open the disc and create space. It also shows the degenerative process of the spine starting to buckle and close off on what this looks like if we don't get it fixed. So it shows them the road that they're traveling on now, what happens if they don't get it worked on, and then also shows them what the therapies look like, whether you're utilizing decompression therapy, neck or low back, soft wave therapy on the knees, on the shoulders, on the low back. This 3D consultation has every single scenario that you might need to get them to visually understand during their report what's going to happen. So what we're doing is we're letting them see the end result before they even get started. Now you might think this is the point where they're ready to get started, but we're not quite there yet. We want to really take the time to pre-qualify or disqualify to make sure that they are a really good fit for your office, for what you have to offer, for the care that you're going to provide to get to the end result, 10 out of 10, getting them as close to 100% better as possible. What this might look like is from 1 to 10, how committed are you to getting this low back fixed? And if it's anything under a 7, we might want to ask them, what is holding you back from being committed? Because we typically will not work with people that aren't at least a 7, 8, 9, or 10 out of 10 when it comes to their health to your end result. The next few things that might disqualify a patient from care is their time commitment, being able to work. Maybe they travel Also, a spouse might be an objection, so the spouse might not be committed to their health and their decision. So we're gonna make sure to check all of these to make sure they meet the criteria today. So if they aren't ready, don't be afraid to stop the conversation and take it back to what is their why. Ultimately, your responsibility as a doctor is to know their why and to be able to connect back to that. And it's more than pain. Remember that. Now, if they do feel ready, you're getting the yeses, you're getting the connection, their energy is being pulled towards you, and you are feeling like you guys are connected and they want to get started. That is when we present the perfect care plan for them to get their desired result. Now, as a chiropractor, you should have a system where you're quantifying the amount of care that you are delivering. For an elite level chiropractor, you might be between 4, 6, 8, 12 months of care, depending on a few different factors. Within that care, there might be 24, 48, even 96 visits. Again, depending on a few factors. Those factors are the arthritis that's built up in their spine that you see in X-ray, the overall degenerative process and how many discs are starting to degenerate in the spine. Of course, their age, their history, and any other objective findings that you found while they're laying on the table. All these numbers are going to increase the severity and the intensity of your care plan. From there, you'll have different tools. The more tools you have in your tool belt, the more people you can help. For decompression therapy, that's where we're working on the degenerative discs, starting to bring fluid back into the joints. For the shockwave therapy, that's where we're breaking up the scar tissue, breaking up the arthritis, and starting to increase the blood flow, creating more permeable muscles and strengthening and mobilizing any of the tendons and any of the muscles around that injured area. And of course, as a chiropractor, your number one tool is the adjustment to make sure that you're mobilizing and creating mobility in every single joint specifically to their condition. With these three tools, I found that you can be and build a practice that is absolutely bulletproof. So the last part of recommending your corrective plan is going to be the financial conversation. So you made this up the day before, you went through specifically what insurance do they have on their account, what is covered and what's not covered. If they're a veteran, of course, they're getting treated special. If they've been in a car accident, of course, it's fully covered. Now, from there, depending on what coverage is there and what's not, if they were referred in or if not, we're able to go and show them the full care price, full value. Then we're able to show them after their coverage or their referral discount, this is what's left. Then from there, we'll go ahead and show them they can make payments, 2, 4, 6, or some will utilize care credit, but most people, 98%, they'll typically prepay. They get the biggest discount. They can use a check, they can use a card, cashback rewards. If they don't put it on one, they can put it on 3. So ultimately being able to deliver those options in a professional manner and be able to have the specific plan for their scenario is gonna make them feel comfortable and confident to stick with you. And that's what my report of findings looks like in my chiropractic practice. Go back through every stage of your report of findings and evaluate. Which ones are you skipping? Which ones are you rushing? Your ROF isn't just a step. Low case acceptance, patients dropping off, revenue that doesn't match your work. It's the root of a lot of what's holding your practice back. These can all be fixed with an elite report of findings for your chiropractic patients.